Thank you very much, Andrea, and pleased to see you, Gianmaria, from very far part of Italy, but hoping to see each other in presence next time. Today, the topic is to deal and to, how do you say, evaluate the better performances in terms of fertility in women.
You have to share your screen.
Using integration. Yes, yes, I am arriving. I have just to reach the... Okay, it should be coming soon.
Yes, yes, we have no doubts. Okay, perfect.
Okay, should be here. Anyway, the topic is just how we can improve fertility, how we can improve the impairments in terms of dysmetabolism, especially in a case, in a classic case of gynecological endocrinology, that is in PCOS. The real problem is that PCOS is a rather complicated disease, which is occurring up to 20% of the population. And this depends on several issues that are mainly related to the ethnia or to the genetic predisposition. We know very well that the Rotterdam criteria have clearly defined that PCOS is present when at least 2 over the 3 issues are present. The excess of androgens in terms of clinical or biochemical evaluation, anovulation or abnormal menstrual cyclicity, and an ovarian morphology, which can be related to be with a shape of polycystic ovary. Well, we have absolutely to start saying that not all PCOS are coming just as a random occurrence. There are predispositions and conditions that might trigger the occurrence of PCOS that are due to the fetal programming or maybe of being born as UGR or small for gestational age, but also the familiar predisposition to special endocrine diseases such as diabetes. In any case, these can affect the evolution during adolescence and creating the condition for having adiposity in excess, so that to have overweight or obesity, and then abnormal menstrual cyclicity. And later, after the fertility area of life, when going through the 40 up to the 50, we might have the triggering also to other diseases rather important, such as diabetes or cardiovascular diseases. So the thing that we have to face is that the 3 issues of the Rotterdam criteria might be combined one with the other, so that of having 4 distinct phenotypes. And the more severe phenotypes are those where hyperandrogenic condition is present. Classically, through the studies from Frank and Berga, we have in any case to consider that the occurrence of PCOS is a, how do you say, a unpolite and unfortunate combination of genetic factors and epigenetic factors. And all together, these kind of actions are able to impair as a sort of model of combinatorial endocrinological disease. It might trigger the occurrence of PCOS. But the things that we have to remember is that is not only the presence of such as hyperandrogenic conditions, ovulatory disturbances, and abnormal ovulatory capacity that is occurring in PCOS, but also a higher risk of getting other diseases, especially during pregnancy. This is rather important since gestational diabetes, hypertension, and premature delivery are quite frequent occurrences during a PCOS that becomes pregnant. So the things that we have today to disclose a little bit and to understand is how to manage the adverse situations that PCOS might have due to the occurrence of specific conditions such as insulin resistance, hyperinsulinemia, which is a compensatory conditions, and other diseases affecting the liver functions that is affected by hepatic steatosis, and other conditions such as dyslipidemia. We have the higher risk in PCOS patients of having, obviously, diabetes. But insulin resistance is a classic disease in anovulatory patients. in hyperandrogenic patients? No, not at all. The fact is that insulin resistance is classically and unique in PCOS. It is not found in hyperandrogenic women due to other conditions, let's say hyperprolactinemia or adrenal dysfunction. Is classically occurring just in PCOS, but not only in overweight, obese PCOS. Up to 75% of them might have hyperinsulinemia, but also normal weight PCOS patients. This clearly gives us the idea that such high level of insulin are probably due to some other built-in mechanism that might trigger such kind of conditions of hyperinsulinism. Well, just giving a graphical idea of this, you see here that up to 60, up to 70% of patients with obesity might have hyperinsulinemia, but mainly not obese patients might have up to in 40% of the cases the presence of a compensatory hyperinsulinism. And insulin is a rather important hormone. It's a proteic hormone that is able to act and to modulate not only reproduction at the central level in the sense that it might trigger and stimulate GnRH release, but it also acts on the granulosa cells, promoting the production of androgens. And you know very well that androgens are the starting point through the aromatase conversion for the production of estradiol, but higher level of androgens due to hyperinsulinemia might induce a lot of trouble, and mainly the atresia of the follicles inside the ovary. But is insulin resistance a sort of classic disease? Well, the answer is no. The presence of insulin resistance is something which is physiologically established, especially in 3 moments of the female life. During pubertal maturation, and this occurs also in young males, we have the growing on of the skeleton, of the muscles, of the organs, and this is due to a physiological occurrence of insulin resistance that improve the activity of insulin and the level of insulin so that to have the body to grow. But this is occurring also during pregnancy. We know very well that the higher acquisition of the body weight of the fetus is during the 3rd trimester. And during this part of the pregnancy, we have the higher level of insulin circulating in the blood of the mother and also in part in the fetus. But also during menopause. Menopause is a rather peculiar situation where these ladies having an age above the 50s, well, they are characterized by the fact of having a reduced mobility and classically less ability to move in the environmental situations. And so the biology from the very far times, from the Paleolithical times, have decided to have insulin resistance to improve the amount of fat in this subject, so that to give them a certain amount of energy just to go on living without going looking for food. So the very starting point of this is that we need in all PCOS, as stated by most of the most important society all over the world, establish if these PCOS patients have a hyperinsulinemia. And we can perform this checking just doing an oral glucose tolerance test, performing the test not only for glycemia, but mainly for insulin plasma levels. And it is well known, and this is the important issue that we have to underline here, that the insulin sensitivity is going down and is reducing with a growing on of the body mass index. And this is correlated in a very rather important manner with the increase of the systolic blood pressure. This means that the higher is the body mass index, the lower is the insulin sensitivity, the higher then is insulin resistance, the higher is the cardiovascular risk. And this is rather important since as a central point of the metabolic syndrome, which is a very unfortunate, widespread all over the world disease, the metabolic syndrome has in the center the increased insulin resistance, which is the trigger for the pro-inflammatory and pro-thrombotic state, as well as for the altered lipid profile and the risk of hypertension. So when we talk about PCOS, we have to remember this kind of listing. If you check it, you see that there are most of the many triggers of the risk of the cardiovascular diseases, as well as of a lot of other diseases due to the lipid profile control. So this means that PCOS have incredible risks of getting a lot of diseases. But insulin is a rather important hormone, not only for driving the activity on the metabolic aspects, but mainly if it is too much circulating in the blood, in modulating in an abnormal way, whatever is the control, the neuroendocrine control of reproduction. So this means that on one side, we have the impairment in the metabolic control of our biology, and on the other one, we have an impairment in the control of reproduction. So according to this, PCOS is a sort of black hole. It's something which is absolutely complicated. There are absolutely a lot of items that we have to consider. And up to now, and this is true, we have to say this, there is no standard cure. We have not yet established a specific track to follow just to cure PCOS. Well, we have some first-line treatments, and this depends mainly on what kind of symptoms the patient is occurring. But obviously, you can see here, we have a lot of strategies that might occur and might be applied just to resolve the problem of acne, of the menstrual cyclicity, or maybe the metabolism impairment, such as the changes in the lifestyle, obviously, and the use of metformin. But if we have to consider the ability of PCOS to get a pregnancy, well, obviously, we need to have something that is able to improve or to create a better ability to have ovulations and then the chance of getting the fertilization of the oocytes. Well, such kind of treatments have been clearly organized according to the fact of having or not having contraception. So this is just a resumption of all what I have said up to now, and you can understand that whenever you have oral contraceptive pill or whatever is anti-androgenic combined with oral contraception, obviously there is no chance of fertility. So avoiding such kind of treatment, what can we do just to improve fertility in these PCOS patients? Well, there are several strategies that might be suggested and that might be actively operated in these PCOS. So let's start saying the first thing at all, absolutely the most important, lifestyle. This is an old paper from 2011 from the group of Moran, and they clearly demonstrated, this is a beautiful meta-analysis, that if you pay attention to the food, you reduce carbohydrates and glucose eating well. This reduces the body weight, improves insulin sensitivity, and obviously reduced the insulin plasma levels. And the waist to hip ratio, an important classic measure that you can take in your patients, is going down, so that to demonstrate that you are improving the control of body weight and of the amount of fat in the abdominal part. But are there, above the fact of having a little bit of exercise and a control of diet, specific strategies for these patients to improve the metabolic impairments? Yes. First of all, the most important and commonly used insulin sensitizers, that is metformin. This is a perfect treatment. It's quite old. It is a 64 years old treatment, but it's perfect up to the fact that you have to use low doses every day, since it might create some problems. Anyway, it is clearly, this is a 12 years old paper from our group, demonstrated that metformin gives the better results whenever you have a real hyperinsulinemia in these patients. High level of insulin in baseline conditions and high insulin response to the oral glucose tolerance test. And the real problem for these patients is the body weight. The problem is the body weight, since whenever you have a high body weight, you have to improve the dosages of metformin up to 3 grams every day. And above 1 or 1.5 grams every day, you might have a lot of side effects, such as nausea, vomiting, and gastrointestinal disease. And this reduces, obviously, the compliance of the patient. So is there any kind of other solution? Well, there are solutions, integrative solutions that probably might be suggested and might be used for these patients, especially for those that would like not to go through the treatment with metformin or would like to expect getting regular menstrual cycles through the use of integrative compounds, such as some of the ones that I have listed here: carnitines, cysteine, arginine, or inositols. Well, all such kind of integrations have been demonstrated to be able to affect positively the insulin sensitivity, to induce a higher improvement of insulin sensitivity whenever we have a PCOS, but using each of them at very high daily dosages. So the real problem is probably that we might expect to use them in a more clever way, that is combining them. But first of all, carnitine is probably one of the most important issues that have been demonstrated in the last 30 years to be able to reduce insulin sensitivity, improving beta oxidation of glucose, so improving production of energy and mainly reducing the availability of glucose all over the body weight. Such kind of activity is played at the level of the Krebs cycle, improving the utilization of the beta oxidation so that to eliminate the glucose inside the cells, mainly at the level of the central nervous systems, as well as you can see here in this table of several papers, at the muscle level. But another interesting and important element to control insulin sensitivity is cysteine. Cysteine is able to remodulate and to reactivate glutathione, which is the most important antioxidant compound inside of our biology. And such kind of activation is absolutely necessary just to block and to eliminate the so-called ROS compounds produced by excessive oxidations inside our body at all levels. Cysteine, as well as N-acetylcysteine, are able to counteract such production of ROS, and mainly affecting through a complicated pathways, is able to block or to reduce the pro-inflammation, which is a trigger of insulin resistance. And arginine. Arginine is another important compound. It's important in our biology, and is interesting to observe that the level of arginine in patients with PCOS is absolutely reduced. And arginine is important since it is involved in the production of nitric oxide, one of the most important substances which is able to induce the vasodilatation at the endothelial level. But on the other side is also nitric oxide involved in the activation of and the reorganization of the glutathione pathways so that to block ROS. This is rather important since it has been demonstrated that in PCOS we have a reduction of the production of nitric oxide for the lack of specific enzymes which are not really expressed adequately in these patients. So we have a sort of built-in problem that have been demonstrated, and you can see here from this very nice paper from Carvalho, that the addition of arginine is able to induce a higher express of the insulin-induced AKT phosphorylation. And AKT is a rather important molecule which is able to activate the GLUT4 vesicles, which are responsible for the upload of glucose in all over the cells of our biology. And that's why we have decided to try to combine carnitine with cysteine and arginine. And we made a very nice experimental design using a very easy integration, a SEC that is administered every day in this group of patients, 45 patients with obesity that have been characterized with the Rotterdam criteria, and all of them were treated for up to 6 months. And you can see here that the whole set of patients demonstrated an incredible reduction of the insulin in baseline conditions with a nice improvement of the total cholesterol and HDL profiles, with a relative reduction of the body mass index, since these patients were instructed not to change the lifestyle. When we checked these patients, we observed that there were two groups of patients, those having high level of insulin in baseline conditions, and there were 39 of them, and just 6 up to 45 did not show such kind of hyperinsulinemia in baseline conditions. Well, the highest amount of these patients treated with this combination demonstrated the best results in terms of the improvement of the dysmetabolic conditions, with a very nice changes also of the OMA index. And this is a rather important effect, since we know very well that OMA index is the demonstration when it is abnormal of the abnormal insulin resistance present in these patients. Well, facing the fact that all these patients were undergoing the oral glucose tolerance test, well, we have here depicted the profiles of the insulin response. On the left, you see all the patients all together. You see in baseline conditions how high is the insulin response. And look here, how is incredible the reduction of the insulin response after just 3 months, and a higher reduction is also occurring after the 6 months of treatment. But when we subdivide the group of the patients in those with hyperinsulinemia in baseline conditions with a normo-insulinemic patients, you see that the changes are very impressive in the patients who really show hyperinsulinemia, not only in baseline conditions, but mainly under the oral glucose tolerance test, while changes, minimal but important, are occurring in the small number of the patients with normo-insulinemia. But why is such kind of combination of nutrients able to affect in a positive way the metabolic pathways? Well, in PCOS, we know very well that the oxidative stress is impairing the ability of arginine through an abnormal enzymatic situations to produce nitric oxide, and the reduction of the nitric oxide impairs the nitrosocysteine and nitrosoglutathione production. This is also due to the fact that there are a reduced amount of thiols radicals available for such production. All these impairs the GTP to cyclic GMP passages, and this alters and modifies the ability of calcium to enter inside the cells. But when we give arginine and when we give cysteine or N-acetylcysteine, we have the reestablishment of such kind of ability to produce inside the cells nitric oxide, and we restore the ability to reactivate the production of nitrosocysteine, which is a restabilization of the impairment in the control of the calcium channels. This is rather important, since such kind of passages from GTP to GMP is absolutely relevant not only for the endothelial cardiovascular aspect, but also for the oocyte development, since these kind of channels and of functions are occurring inside also the follicles, inside the ovary. So this is rather important, something that is rather important to be resolved, and the impairment needs to be eliminated. So going through a sort of comprehensive summary of these, we can say that the integrative and the combinatory approach with carnitine, arginine, and also cysteine, improves on one side the effects through carnitine of the reduction of the hyperglycemia, and on the other side, the reduction of the oxidative stress, so that we have a reduction of pressure and also triggering to have insulin resistance, and on the other side, a pro-inflammatory state. This is rather important. It's rather important also to have a new evolution of such combination, since why not to consider the addition of inositol? And in fact, inositol might be and has been added to such a combination of carnitines, arginine, and cysteine in the amount of 1 gram every day. Such kind of addition is rather important, since we know very well that inositols are element essential in the functions inside our biology. And myo-inositol is a small molecule very close to the structure of glucose, is a sort of post-receptor signaling for a lot of hormones. Inositol is normally produced in our biology from glucose 6-phosphate, but mainly is coming from the food, is coming from beans, from vegetables, from the meat, and is the passages through the two important, most important shapes of inositols, which is myo and dikiro. The balancing of these is the one in charge of maintaining the ability to control not only the signal of insulin as a post-receptor signaling, but also of TSH and FSH. So look, TSH is the other important hormone for the control of the metabolic structure of the endocrine control of metabolism, but FSH is the first and most important gonadotropin that stimulates the evolution of the follicle. So myo-inositol is the rather important element so that to have the better response of the granulosa cells and oocyte towards the evolution to ovulation. But also, myo-inositol is able to act on a lot of other activities inside the brain and inside muscles. Myo and dikiro are in balance in specific elements of balancing, controlling not only the metabolism in the tissues, but also the activity, mainly the myo effect on the FSH signaling, similarly to the fact that myo is able to induce a better performance of insulin and TSH, so that to have the better performances, obviously, of our biology. Well, we tested myo-inositol, having good results not only in patients who were obese with a reduction of the level of LH, but mainly the reduction of a level of insulin. And we observed that this was occurring also in the so-called group of normal weight PCOS, where again LH was reduced, but though of normal body weight, in baseline conditions, at least in this study, the level of insulin were normal, but mainly through the effects of myo-inositol, we were able to better control the reproductive hormones. And these, in this group of patients, reduced the level of androgens. But many other issues have been done, and the use of myo-inositol as a supplemental treatment was able to improve the ability to conceive in patients with PCOS going through the reproductive programs. So this means that probably we have now the better chance to get the better performance of the integration, choosing the combination of them, having carnitines in acetyl and L-carnitine added together with the cysteine and to L-arginine with the addition of myo-inositol. The first group are working on the metabolic issues, while myo-inositol is improving the management of the reproduction through the post-receptor signaling. The problem is that PCOS, as you can see from this cartoon, is a rather complicated syndrome. You see, complicated since it clearly drives the lady towards the failure of the good health with the cardiovascular risk, hypertension, anovulation, dysmetabolism, the risk of diabetes. So the best chance is to take the advantage of the integrations to try to avoid such evolution. You see here, PCOS is the starting point, might be induced by obesity. There might be epigenetic factors, might be also, how do you say, induce a certain degree of stress. And this kind of stress is just a triggers of other conditions, of these metabolic conditions and alterations of endocrine control of a lot of functions, predisposing to dyslipidemia, diabetes, hypertension, and cardiovascular disease, and mainly driving also at a certain conditions to cancer risk due to the imbalancing of the hyperestrogenic conditions that PCOS might have. So I think that we have to look at PCOS with a completely different view, trying to improve the ability to re-establish the equilibrium of the normal nutrients that are needed with a lifestyle just to get a better performance in health and in the chance of to have a baby. Thank you very much.